Hey, what's up, folks? Mercedes Pallmeyer here, and today we're going to be talking all about pull-ups and basically like elbow pain that comes from pull-ups. And so for those of you who don't know yet, Kirsty Grosart, she is actually also known as the Garage Gym Girl. Her and I actually collaborating on a pull-up program, but we got some really amazing questions about elbow pain when it comes to pull-ups, as well as like a lot of climbers asking a lot of questions about elbow pain as well. So I thought I'd bring in an expert. So today joining me is Dr. Max Wong. She's a climber, a route setter, and a chiropractor. She's treated many athletes from amateur to professional climbers. She's seen it all. So welcome, Dr. Wong. Thank you so much for being here.
Oh, thanks, Mercedes.
Yeah.
I'm super
Um,
stoked about this and excited.
Awesome. Well, just to start off with, do you mind introducing yourself and kind of giving us some background?
Yeah, sure. First of all, as like a general disclaimer, I'm a doctor, but I'm not your doctor or anyone else who's listening to this, your doctor. So I haven't assessed anyone for a particular condition. So whatever we're talking about here should not be interpreted as medical or chiropractic diagnosis or treatment. We're just here to help, think of questions and strategies that might work for you and your healthcare team when you're trying to do pull-ups and stuff. Um, yeah, so I'm Dr. Max Wong. My pronouns are she and they. Like Mercedes says, I'm a climber. I'm also a route setter. I'm based in Toronto, Ontario, Canada. And I do have a lot of training, like on top of being a chiropractor, in specifically the diagnosis, treatment, and rehabilitation of climbing related injuries, because I love climbing. I have like an honors BSc in biology and visual arts. I also have Bachelor of Education in biology and visual arts. I have a Doctor of Chiropractic, and I'm also certified as a sports emergency first responder. So I've provided medical coverage for a couple of competitions, including the IFSC Youth Pan Ams, Canadian Open Boulder Nationals. I've also done the North American Indigenous Games. I'm also part of like Climbing Escalade Canada. So like similar to like in USAC, so USA Climbing. So the CEC's National Practitioner Network and Integrated Support Team. So yeah, those are kind of like all my like random kind of like credential-y things. And I kind of fell into climbing because it's really fun. I really enjoy like I'm really good at like problem solving and like beta breaking and stuff and technique. I don't think I'm particularly the strongest climber, but I'm definitely the person who like has the most fun at the crag. I've never I'm part of this. Like the funny thing is like people are like, oh, you're so athletic. I'm like, I don't consider myself athletic at all. When I was a kid, I was actually severely bullied in gym class. Last kid picked on the team. I'm terrible at calculating projectiles heading towards me. So like that's like all team sports. So that's like, so when people are like, oh, you work with athletes and what's that like being so athletic? I'm like, yeah. So yeah, it's kind of like about me where I'm.
Ah, and it's really interesting, like what we term being an athlete, because I feel like actually for a really long time, a lot of climbers that I worked with would not consider themselves athletes because they're like, well, I couldn't catch a ball, but I can climb really well. So that means I must not be athletic. So it's really interesting, like this, like kind of like box that maybe we put ourselves into just as climbers. That's like as a side note, I feel like climbers are some of the best athletes for sure, in so many different ways compared to like our traditional sports. Cool. Well, thank you so much for introducing yourself. So let's go ahead and answer some of these questions that people wrote in. And the first couple are actually just about pull-ups in general. So we're actually not going to talk about climbing just yet. But the first one is, when it comes to pull-ups, why do people get elbow pain? And, generally, like, what is causing this pain?
So like keep in mind that pain itself is a signal. Generally, your nervous system will generate pain or interpret when it interprets something as dangerous or harmful. So like your brain's primary directive is to just keep you alive no matter what. So sometimes when we get new or different sensations, if your brain might default to like, this is pain, because that's its whole job, to try to keep you alive. It also depends on the context of which you are experiencing pain, or, how, and also how you kind of like perceive pain, like the context of it. The intensity of pain has actually no correlation to the amount of harm or damage that you might be experiencing, if any. Nervous systems just do weird stuff sometimes. So try to think of it when you get what you think is pain as a smoke alarm. Like if the house is on fire, or you left toast in the oven, or the batteries are weird, you're going to get the same signal. So it's best to kind of like look at the situation and see, why is this signal going off? So let's say like if you're doing pull-ups and stuff then, and you start to feel something in your elbow, like give yourself a second to actually feel that sensation. So where is it coming from? What movements kind of like trigger it, or relieve it a little bit? Is it tightness? Is it actually pain? Does it change when you change your position, or does it change when you change your load? So this can tell you a lot about what's actually happening like in your elbow. So that's kind of the thing I'd like to think of first, where if you're first starting to do a new movement, or like when you're doing pull-ups, you're like, what is this thing I'm feeling? Your brain might try to default it to be like, it's pain, but to actually take a moment and like, okay, what is the sensation? Is it just tight? Is it just sore? Does it feel a little burny? And that can tell you a lot on, you know, what to do. So if you are doing pull-ups and you start to feel something in your elbow, and it's kind of like coming on and off, it might indicate that maybe your tissues are having a bit of issues with the amount of load that you're pulling through it. This is especially new if you, well, it happens more often if it's like in a newer context. So if you're doing a new activity, or if you have suddenly increased the amount of intensity or load that you're pulling through it. So that's why I'm like, it's tricky. So when someone's elbows hurt, or they may experience pain when they first start doing pull-ups, it's like, well, take a second. Is it actually pain that you're experiencing? What is the actual sense? Like, see if you can kind of figure out what that sensation is. And if it is, pain that's happening when you're doing pull-ups, then it means that your tissues right now are having a little bit of difficulty with load capacity. So that's where, like, especially with like a training program, or if you're doing like a new, like a pull-up program or something, that when you start to modify the load, it kind of helps you figure out, are your tissues where they need to be in order to continue this activity? If not, then you probably need to just modify the activity. So modify load, modify intensity, modify frequency, modify range of motion, stuff like that. So that's kind of what's generally happening. If it hurts while you're doing pull-ups and you're like, this is definitely painful, then you kind of need to take a look at, are my elbows able to handle this at 100% right now? And if not, then maybe I should bring it down a little bit. That's generally how I kind of like approach it.
Yeah, that's fantastic. Yeah, and I think that perception of pain is really important to remember, because it seems like anytime that our bodies somehow like perceives change, sometimes it can just come up as pain. Mm-hmm. So that's fantastic. And so now, like, thinking about pull-ups, let's talk about climbers. And I've known so many climbers who, they climb a lot. Maybe they train pull-ups once in a while, but then the second they start doing max pull-ups, they start getting elbow pain. So like, it kind of sounds like you're talking about that a little bit, like a change in load. Do you think you could maybe talk a little bit about like how like climbers can maybe like when they start doing max pull-ups and they start getting elbow pain, maybe what that's a little bit more about, or like how to mitigate that?
So I think it depends on where it is, kind of why. So when we're doing pull-ups and stuff, like if we think about our muscular system, we have like our muscles, and then we have the tendons. And the tendons kind of like are this tissue that kind of like wraps around the muscle, and then at the ends of it, it will insert it into the bone generally. So think of it like a sausage sack. Like I don't actually, that was a weird way to say that. But if you think about like a sausage, and the casing around it, the casing is kind of like that tendinous connective tissue, and the inside is where the meat of it is. So that's kind of how like muscles are, the little ends are the tendons, and those actually attach onto the bone. So when we start working out or increasing the load, your muscles adapt super quick. And it's because we have a lot of blood flow, vasculature, nervous tissue like around there that allows for that. Tendons are kind of slow, like they're just slower because you don't have as much like nutrition, blood flow going to that area. It's not that they don't have any, they're just slower at it. So sometimes if someone is like, okay, I'm gonna like start ramping up my max hangs and stuff, and then your elbows are like, oh, like I don't understand, I could pull really hard, and then I'm just hanging here, why are my elbows getting sad? Sometimes it's like, it might be partially like your muscles are like, we're so jacked, and then your tendons are like, we're not jacked yet. Hold on, give us time. And so like that's kind of like, so keep that in mind. Like if someone's like, oh, I'm super strong and stuff like that, and they start to like increase that max hang or whatever, then sometimes when the tendons get and usually around the elbow is where the tendons insert into, for your like your biceps, your brachialis, your brachioradialis, like basically the primary elbow flexors. That sometimes it's just like the tendons are like, we're not quite there yet, hold up. So it could be partially that. If it seems to be like an ongoing issue where it slowly like keeps happening, or it becomes like something that seems to be a little more chronic, then that means like you're having difficulty. The tendons are also super weird, but they're having a bit of difficulty managing that recovery load cycle. So depending on like tissues also like they respond in different ways to different types of stresses. So with the tendons, if you're getting a lot of chronic tendon issue and it's fairly, if it keeps happening, then sometimes it's like, it might be that the tendon is having difficulty coming, like, I guess like coming to terms with its new job of like increasing load. Sometimes it's also like if the tissues just aren't ready when you first start, and then as you're loading it, they're like, we're still trying to figure this out. And tendon pain too is really weird because as you load it, it slowly will feel worse, and then it starts to get better. But it's not like within like a week or two. This is like over several weeks of like tendon loading. It's super weird still. People are still like, I don't know, it's kind of working long term, but it's disheartening within the first few weeks because you're like, my elbows hurt. Yeah. What do I do? Mm-hmm. So I don't know if that really answered your question.
No, that was probably one of the better explanations on like how tendons tend to lag behind the muscle development, and why people feel like so many people I know, they're like, I feel really strong, but I got hurt. Like, because they were like, well, I was able to do it. Why did I get hurt? Oh, it's because like the tendon isn't as developed. So that was really great. And sausage sack, that's the new terminology.
I didn't come up with that one. Well, Tyler did. He was just like, oh, it's going like this. I'm like, oh yeah, that's actually like a better way than I explained with like this like sausage thing. But also keep in mind, anytime there's like a transition point in tissue types, that's where we may experience a little bit of like weakness. Like, so if you think about like a door and a wall and a hinge, the hinge is where it gets kind of wonky over time because it's a transition point of which forces travel through. So where the tendon inserts onto the bone, that tends to be where people feel it the most, because that's the area that tends to get more like, hey, we're a weird transition point, give us time. Also, our blood flow is not as great as your jacked muscles. So get like, hold up. I mean, we'll do it, but like, we're still trying to figure out how to do it. And you're like, oh, okay. That's kind of what's happening.
Yeah. Okay. Awesome. So in terms of, so let's say someone's like, okay, I'm doing pull-ups, but I haven't really trained much before doing my pull-ups. What other areas of my elbow or like my arm should I maybe like focus on so that I don't necessarily get hurt when I'm doing pull-ups? So I guess like really what I'm talking about is like muscular like imbalances seem to sometimes have a part in causing some sort of like pain in the elbow. Are there exercises that you find that help your clients so that they don't end up getting elbow pain?
Mm. So I think that, so a lot of it is load management. And load management isn't just like how much you're loading it, but it's also the frequency at which you're loading it. And also, are you recovering enough between loads? This is a huge issue generally with climbers, because when we climb, we're just like, oh, I'm gonna do a short climb, and a short session becomes like 4 or 6 hours because your friends roll in, and then you're just like, dead. And then if you're, and then you're like, okay, well, in the morning I'm going to try to do some like hangs or pull-ups, and you're just like, why are my elbows like garbage right now? And it's like, no, it's because you climbed for like 4 to 6 hours yesterday. Your tissues just like they just like expended themselves. They probably need you to like actually give them time to like come back and like build and get strong. So for that, I like to like, a lot of it is that load management of not just how much you're loading it, but also, are you having enough rest between loads? Are you, other things I consider are like, are you eating enough? Are you eating enough of the right things? Are you sleeping enough? Is your sleep actually quality sleep? Like those are like the bigger factors. Also stress, if you have chronic stress, it can actually inhibit your ability for your body to like heal appropriately. So those are kind of like the background factors I like consider with it. Um, and generally, like, it may mean that you may have like an underlying, like basically healthy. I'm like, how do I, how, what is a good, so your tissues, when you train them or when you're using your tissues, they can handle a certain amount of like capacity to them, right? So whenever you get injured, it's because the load has exceeded the capacity of the tissues at that time.
Mhm.
So how we kind of manage that capacity is through dosing, which is like basically exercising and like timing their frequency, but also making sure that the tissues have enough time to recover. So like eating the right things, sleeping, stress management, stuff like that. So if a person's like training and then they end up getting injured, then sometimes it's like right now your tissues can't handle that capacity. So why can't it handle that capacity? Is it because it was just too much for you, like that your tissues were just like, there's not enough load? Or are these other factors affecting your tissue's ability to recover between loads in order to slowly increase its capacity? So if someone's like doing, so if you start like exercise, I'm like, forgot your question already, because I'm like, let me put some background into this. um
Oh, with
so
it. It's all right.
so for that, in terms of like, if someone's like, oh, how do I like are there certain things that I can do to help like not get injured? A lot of it is, again, that managing the dosage and the recovery of whatever you're training, or how you're loading your tissues, like, to summarize that. So sometimes when people talk about like, oh, like muscular imbalance, sometimes it's not, like, that's also a weird thing, because people don't know, we don't have any set guidelines on how much of an imbalance counts as an imbalance, right? Because if you think about like how you're really strong at doing this, you're not, and then but the opposite movement, you may not be as strong. Is that not as strong enough to be a contributing factor for your elbow getting hurt or injured? So that's why it's tricky to talk about muscular imbalance, because we're like, everyone has some imbalances, but is that actually enough of a contributing factor for your elbow to be hurt? Like, so that's why it's like a tricky thing. So I try not to focus on muscular imbalance, but building up, like making sure that everyone can carry the load of what you're doing. So if you're doing hangs and stuff and you notice that it's hard for you because you can't sustain the grip, then your limiting factor isn't really your elbows or your shoulders. Your limiting factor is actually your grip strength. So you should probably actually focus a little more on your grip strength with your pull-up training. And that's part of it, versus some people are like, oh, I'm holding a thing, I have really good grip, but I notice my elbows are slowly getting, oh wait, it looks like I'm pushing up, but I'm trying to sink down slowly. That's what I'm trying to show you. So if that's happening, then that means your elbows are probably the limiting factor of that movement. And therefore doing those pull-ups are probably like, that's actually a really beneficial thing for you to actually train. So I try not to look at it as like, an imbalance of like one side versus the other, but like what are the limiting factors in maximizing your like that potential to do that move or to do that exercise. So that's kind of how I look at it. So for me, for example, I'm just like, oh yeah, I'm surprisingly good at like really doing like a tight lock off with both arms. But I notice for me, when I'm grabbing a hold, what's stopping me from like completing the movement is like my lack of grip strength. I can get myself into the position, but I can't seem to pinch hard enough to get that. So therefore my limiting factor is actually my grip strength, not so much my shoulders or my elbows. So is my time better spent me still doing lock offs, or should I actually be working maybe a little more my grip strength? Yeah. So that's why it's tricky to say, because if someone's like, oh, I'm getting a bit of elbow pain, should it be working my forearms more? Am I working more my shoulders? You kind of have to look, and if you're having difficulty trying to figure out what that is, that's when you may want to consider working with a climbing coach or like a climbing rehab, like practitioner or health practitioner, to see like, oh, it's actually because you're not doing this, or maybe you're not actually using that part of your body that you should be. That's like a really roundabout way of answering your question.
That was fantastic, actually, because I think like I used to prescribe a lot of like prehab exercises because I'm like, hey, we need to have this muscular balance for all the joints to make sure that you're as strong as you possibly can be in each of these joints. But like kind of like what you're saying, a couple of years ago, I started to realize like, okay, maybe muscle balance doesn't matter as much in the grand scheme of things, rather than just like progressing all of the exercises and like really looking at like, where do we need to target? So that's actually really great. And it's great because people don't need to spend so much time doing all of these exercises to make sure that they're staying in balance. So in a way, they're like taking down their overall training load as well. And it's awesome that you're talking about nutrition and life stress, because I don't know a ton of like coaches even like considering that as like the whole athlete, where like the deep health component, where like if you're getting injured, it could be something really not even related to maybe like the actual like position. It could be nutrition or sleep or not enough recovery. So that's really awesome. And I really appreciate you talking about that. So I do have a question so I love that you started like kind of like pointing out some like deficits. One that seems to come up, and it was actually like a question on technique, like pulling technique and where the scapula and shoulder should be. So like if you see someone like pulling up and they're doing a lot of this, what would you have them do if you see that scapula position?
So I think it depends on so whenever you're doing an exercise or a movement, you want to think about, what is my intention? Like, what do I want to achieve with this movement or with this training plan? So part of it is that it's not bad if you're pulling like this. It's not necessarily a bad thing, because sometimes that's what you need to do to get to that movement. And it depends on the angle of the wall, the angling of the holds and stuff like that. So if I notice that no matter what the angle or the movement is, that this person is doing the same movement and just rolling their shoulders in, then my question is, well, how does it feel when you do this, when you pull your shoulders down and back and try to push the center of your chest close to the wall? Because if the reason why you're doing this all the time is because you just don't know how, or your body just doesn't understand how to do this, then maybe that's something you should consider looking at. Because if you're doing this all the time, then yes, like it's a kind of like that tissue capacity thing where like you're going to get super strong and really good at doing this. And you know what? Maybe that serves you really well. But if you have a move where you're like this and you have to get your arm back out here, but it would actually be more beneficial for you, physics and biomechanically, for you to do this and then put your arm back here, just because of how it centers your center of gravity closer to the wall, which is just more biomechanically, it's just easier for you. Then maybe learning how to do this will be beneficial for you, when like to increase the variety of movements when you're climbing. So that's like so for me, my concern with that person doing this is that is the reason why you're rolling your shoulders in when you're doing a pull-up because you just love doing that and you're really good at it, or is it because you don't have a lot of movement variety or ways to actually pull yourself closer to the wall? Like that's what those are my considerations. So if a person is climbing like this all the time and they're like, nope, I just do it all the time, I have no problem reaching out, is that necessarily a thing I want to spend time changing for them? Probably not. But if they're like, I can't reach this, my arm just isn't long enough to get there, I'm like, well, maybe you should consider increasing your variety of movement, training that movement, and that way it will actually open up your arm for longer reach. If you're doing a move like that, I'm thinking about like, comp style bouldering and stuff. So is there like the best type of pull-up position ever? I don't think so. What you're trying to do, essentially what I'm assuming is that if you're trying to do a pull-up, or I guess like somehow improve your pull-up, what you're actually trying to do is learn how to bring your center of mass as close to the wall as possible using your arms. Like that's essentially what you're trying to do. And if you increase the variety of movement and therefore the different muscles that you can use in climbing, that's actually very beneficial for you. Like that's why there's no ideal climbing body type. There is no ideal climbing body ratios or anything, because climbing is such a varied sport that what actually is most beneficial for you is to have the most tools, like the most tricks in your bag. If you have a wide variety of movement, then it means that, oh, I can do this compressing move, I can also do this Gaston, I can also stem through here because I know how to, I've trained myself in these different positions and I'm strong in these different positions. So if someone's like, I want to get really good at pulling my center of gravity as close to it as possible, then, and if you're doing this a lot, that's probably not the most biomechanically advantageous way to do it, depending also on the angle, as opposed to like learning how to pull your shoulders back. It depends on if it's suiting your needs or not. Essentially, it's like, what is your intention? What do you want to achieve? Is this movement or this exercise going to help me get there? So that's why that's like a mixed question, because I know some people who are like really good at like, depressing and pulling those shoulders back, which is really great because it pulls you really high. But then if they do need to do a move where they actually need to hold or wrap around a volume or something and then go up, well, then the pull-up, like, it might not be as good for you. Also, I know some climbers who have really big boobs. So they will pull up like this because they're like, if I don't, the volume is going to push into my boobs and I can't climb the thing. So I'm just going to get really good at this because that's how my anatomy is. So that's why I'm like, I don't know if that answers your question either.
That's great because, I think at least a lot of like past science where I think it kind of, a lot, like people would be afraid to do the wrong technique. And then it's almost like a self-fulfilling prophecy because like, oh, I'm doing this thing over and over again and I might get injured, and maybe they do and they think it's because of that. And I'm excited that like so many more people are talking about that. It's not necessarily there's like a correct technique. Sure, biomechanically we can move like the most efficiently as possible, but you can do all of these crazy movements and it's not going to be bad for you. Like just like the Jefferson curl, like I feel like whenever I post something like that, people freak out, like why are you loading your spine in a rounded position? Well, because your body can actually do that. It's not
Mhm.
bad for you. So thank you. That was really awesome. So let's talk about, so if someone comes to you and they've had elbow pain, can you just tell us a little bit about some strategies that you walk them through if they have some sort of like tendinopathy or some sort of elbow pain, particularly from like pulling, like climbing and pulling?
So I think it obviously like depends on why the tissues are getting super sad, I guess. Um, so strategies that I've worked with, part of it is, it's true. Like the reason why I'm thinking so hard about that is because sometimes if someone gets, um, it depends on what the cause of the tendinopathy or the tendinitis is. So tendinitis usually refers to if there's an active inflammatory process happening right now versus a apathy is like something's just going on with it. But so technically a tendinitis is a type of tendinopathy. So it's like a weird wording type issue thing, I know. Um, I think it depends on why their tendon is getting sad. So if it's if it's a recovery issue, then part of it is like, okay, well, we talk about like those, like the whole athlete, like different lifestyle factors. And I have had that happen before where a person would be doing all the right exercises and all the right things. And then I'd be like, I check in with them, we do outcome measures, we reassess and be like, well, why isn't your elbow, like, we expect your elbow to be better by now or feel better or function better by now. Why is it not doing that? And then sometimes it's like, because, oh yeah, I just went through a weird job change or I went through an awkward breakup and have these stressors that will affect your rate of healing. Or sometimes it's they're just maybe like they're not eating enough. Like if you're super active and you're training and you're doing rehab, are you eating enough to actually put those proteins like in the tendon to help it get better? So I will double check on those factors. Like I'll just like circle back and be like, we're doing all the things. um and I often, if it usually tendons respond really well. Again, it depends on the extent of how irritated, or possibly if there's like an injury in the tendon. um, we'll look at like, okay, how's the load management? Are we actually loading it enough to stimulate tissue change? Or is it just like not, or is it just like kind of just bothering it but not enough to stimulate change? I'll also look at the overall biomechanics of them. Look at like it's all basically, it's never just one thing that will like get your tendon sad. So it's never going to be just one thing that's going to help your tendon get better. Like it's never just one thing because you have all these other factors going on. So I will like often reassess because, sometimes when people talk about like, oh, if there's like an elbow pain, there are a lot of things happening in your elbow. You don't have just muscles there. You also have nerves going by there. You have fascia, you have joint capsules. That it could just be random, like something going on there. I actually had a patient, like a climber, who randomly started getting like elbow pain. And then the more this climber would climb, like the worse it got. And he was also a root setter. And he was like, my job, like, what do I do? And then and basically he had been doing more load because they'd been setting more and forerunning more. So there was like a load management issue. And also partially was that like, he kind of never, like when he was doing his fallback was to, when he was pulling, was to pull his shoulder like this, which actually uses a lot more like that bicepy area. So it was like irritating his median nerve because of the way he was moving his shoulder, which passes by this area, which was affecting how he was able to grab and pull things. So that's why I'm like, it's tricky to say, because if you're like, it's definitely like a tendonitis, like we've done like an ultrasound, all this stuff, then I'd be like, okay, well, there's certain exercises and loading that you can do to help with the tendons to just like learn how to heal in capacity. But if it's like if it seems to be like an ongoing issue, you should probably actually get it checked out by a healthcare practitioner, because there are all these other things happening in the elbow that might be affecting how you're recovering that you don't quite see. So that's why it's really tricky to say.
Yeah.
I'm sorry, Mercedes.
No, all good. All good. I know people are gonna want some specific exercises. If it is like something that can be treated with like some load management plus maybe some like isometrics or something, like what would be your top like 2 exercises for folks who are having some sort of tendinopathy? And maybe you can even like mention like this type of tendinopathy could actually be helped by these exercises, if that even exists.
Generally for if it's like the tendinous tissue, there's like, so I'm like my inside my brain, I've just like entered into this, like if I'm staring off into space or suddenly stop talking, it's because I'm inside my brain going to like the stacks of the library and like pulling open books.
Yeah.
So it's like, oh, give me a second, I'm like running up into my brain right now, hold on. I usually would start with just with isometrics, actually. Low isometrics in different angles. Again, it also depends on like where the tendon is, but usually I'll see what the person, I'll check on their range of motion, what their load management is, and be like, okay, well, let's try, decreasing the load a bit and see how that goes, or changing the angling of like the forearm or the wrist, because that does change the way that like different muscles kind of like interact around the elbow. And then we usually start with some isometric. So like holding like holding like a pull-up in different positions. And also it depends on like their pain tolerance, because I'm not going to be like, this is a 10 out of 10 pain. I'm not going to be like, oh, you should definitely do this because it's 10 out of 10 pain. It's like, that's why it's like, it's so tricky. Like I would definitely consider looking at like hard isometrics and looking at modifying range of motion. Those are probably like my top 2 things I usually recommend for a patient. I don't know if that answers your question.
Yeah. So basically, what's great is that you're actually not saying stop what you're doing and just go do some whatever rotator cuff exercise.
Is that a resistance band?
Whatever this is. Rather, let's look at like what it is that you're doing and where, like how, like when you feel pain, you're in this position. So let's load it in that position where it's hard enough, but not causing pain. Is that kind of like the idea there?
Like some pain, and that's the tricky thing. Like when we're talking about like a pain scale, it's like it needs like it, and that's the weird thing about pain too, right? Because you can't really use pain as a definite indicator of like if this exercise is too much for you or not right now, because sometimes it could also be after irritation or if there is an injury. Sometimes the neurons in that area can become a little bit sensitized, so it's like things that normally wouldn't be painful, it might be like, oh, I think this is painful. So that's why it's really tricky to go on pain, like using pain. But I also don't want to push someone to be like, do this thing, even though it's like making you feel like you're going to throw up on the side of the road. Like I'm not going to tell someone to do that. So I usually go by so if a person is like kind of assessing what they can or can't do, I look at range of motion, like the tolerance, and also how does it feel, like if it, like even though it kind of hurts or is irritating, do you feel strong doing it? Does it feel like it's capable to you? Most of the time when people are like, oh, when I'm doing this thing and it hurts, What they're actually afraid of is, am I going to cause further harm or damage to my body? That's actually what we're afraid of. When something hurts, we're like, oh God, like, am I making things worse? Am I ripping a thing in half? But if you think about, like, if you get a paper cut on your hand, you're washing the dish, you're like, ah, and you're like, oh, right, it's a stupid paper cut. And you're like, well, I guess washing dishes is just going to suck right now because my hands are already wet. It's going to be too much of a pain in the butt to get like liquid bandage or super glue or whatever it is. So you just kind of like, okay, whatever. And you just like kind of learn how to like push that out of your mind because you understand what is happening at your finger. You're not causing further harm or damage, maybe some irritation. It's not like it's going to be like, I'm now a crater in your finger. That's not going to happen. So part of it is, if you're doing the movement or the exercise, see if that sensation, if it comes up, how, like, if you pause in that range or while you're maintaining that load, does it change? Does it keep increasing? Does it stay the same, or does it actually start to decrease? Because this can tell you a lot about, like, is it just sensitization? Am I actually making things worse? Or is it just like how again, tendon pain is super weird, which is why everyone's just like, I don't know what to do with tendons because they do the thing that the person told me to do, but it hurts more. I'm like, yeah, because tendons hurt more before they get better, but then people just don't know how to manage that. And often that's why like reassurance is really helpful, and seeing like a healthcare practitioner about that, to be like, hey, no, dude, your tendon's fine. Like this is what is expected. Like it's going to be a little upset before it gets better. So I think that if you notice that it's getting some irritation, like, pause back a little bit and be like, is this actually getting worse as I'm progressing through this? Or is this like, and if that's like too scary for you, then just stay within a tolerable range of motion or a tolerable load for you. So you're still doing something. And when in doubt, like, get it checked out then, because a lot of the time it helps so much when you actually understand what's happening, that like it's not scary for you anymore, because like, oh no, this is what's expected. It's actually okay if you feel this thing, and someone who's spent like a butt ton of time in school and is qualified to tell you to do about that, then it brings a lot more relief to what you're doing. Because I think that's the biggest factor. When people feel weird things when they're starting or increasing their exercises or intensity, they're like, I don't know what's happening. Am I making things worse? When in doubt, like, if you really are nervous or worried about that, get it checked out.
Yeah.
I thought me vomiting words on you again. Sorry about that.
I mean, that's really great to understand like your own level of pain, and like how long pain kind of like lasts. Is it like right after the exercise? Is it like for several days? I feel like that, like for me and a lot of my injuries, I feel like that has helped me a lot to understand my own injuries. And it's great. It's like unfortunate, but also good. If you do get injured, you do learn so much more about injuries in general and your own level of pain in your body. And especially with a lot of like the new science, like this stuff is like, I said, like, I don't like, now I'm starting to hear more and more folks kind of talk about this part of rehab. Whereas before it looked very different. It was like, hey, just stop what you're doing. Let's not load it. Let's stay away from those movements. So I really love this approach. This is really, really awesome. Okay, so let me just look at some of these other questions. I think we got basically all of these questions answered. So that is awesome. So just to wrap things up, where can people find you if they're like, yo, Dr. Wong, I have an injury in my elbow. Like, how can I contact you to do a consultation?
So one of the easiest ways to actually find me is like on Instagram. I'm just at climbing Chiro. Some people have been like, I thought it was churro. And I was like, no, it's Chiro, like Chiro. And I was like, but it's cute because you thought it was a dessert. Climbing, that's tasty. That's cool. So there's that. My website is pretty much like climbingchiro.ca because I'm in Canada. With that in mind, like, I'm like this is also like where it gets kind of weird, because I, as a registered healthcare practitioner, I'm only licensed to practice chiropractic in Ontario with people who are residing or currently in Ontario. So that's kind of like an interesting thing. But I can do consults with other practitioners to try to give them, give an idea of like, oh, what may be going on. So that would be under, I guess, like a classification of consults. It's still like, I'm sorry, humans out there who are like, can I ask you a question? Because of these these limitations in like as a regulated healthcare practitioner, that's part of the reason why I'm like, I can't really just be like, let me throw out all this advice, because I technically would, yeah. It's a weird question, but yeah, definitely. I do in all of Ontario, I do online consults. And I also have, my office still open. I still do like in-person consultations as well in Toronto. So those are best where they get at me, I guess. Is that a thing? I heard it was on the internet one, get at or don't at me. I'm still trying to figure out what that means. I'm like, what internet? But
yeah,
I think
that's great.
it.
I'll link to all of your stuff in the comments below. And yeah, for everyone watching this, you should definitely check out Max's Instagram, because this is actually really great. This is how I got to like get to know Max. Was we were like playing with some like push-up variations, and she just like broke down all of the biomechanics of like all of these different push-up variations. I was like, this is the kind of nerding out that I want to see. So definitely check out her Instagram. It's really awesome. And yeah, so thank you so much, Dr. Wong. I really appreciate your time. This was a lot of questions, and I really think you did an excellent job of like helping us understand pain, I think, in general. So thank you. And
you're welcome. And I hope this was like helpful. And I do know sometimes I'm just like, let me throw up all this information on you. What is your question again? But thanks for asking me and like asking me to do this, because it was super fun. And I'm a huge nerd. So cool.
Cool. All right. Thank you.